Good afternoon. Hello again. It's Dr. Chris Kingswood, and I'm here with an update about COVID-19 and what it means for us in the TS community. And there's some evidence coming out about the outcomes. Thankfully, they don't seem to be any worse off than anyone else of their age or with their general problems. And a TS doesn't seem to confer any special vulnerability of its own. There are certain conditions within TS that make you more vulnerable, like having LAM or significant impairment of your kidneys. But just having TS seems to be okay. And even for those people who are on everolimus or sirolimus, they don't seem to have done any worse than or they don't have had any more trouble than we would have expected from someone else of their age. People with TS who have COVID-19, most people won't need to go to hospital, but those who do, because it's more severe, are looked after and treated in exactly the same way as anyone else. So no special things need to be done for TSC, apart from looking after the TSC itself and the usual things they would have to do whether they were at home or in hospital, such as looking after epilepsy. So far, we haven't seen any difference in outcome in people with TSC and without, so that's very reassuring. But the hospitals are able to escalate treatment and get people into more intensive care or more intensive support if need be. Hospitals now are getting back to normal, and they're beginning to see patients in clinic in general, and they're able to start scans and diagnostic tests. There is a backlog of lots of people who've been waiting for tests, so that's introducing some delays, but urgent things are being done urgently and prioritized. Most hospitals have already started seeing the occasional patient who has to be seen face-to-face to make a proper diagnosis. But it does vary from place to place. So do ask your local hospital or clinic what's going on with them. At St. George's, we're still doing teleconsultations and video consultations for most patients. And that's really to save them the trouble of traveling and to save them the risk of being on public transport or out in general. But by August, we'll have some more space to see people in the clinic. And I think most hospitals will be like that. And I think going forwards, all hospitals for all types of patients, not just with TS, will be offering a mixture of teleconsultations and face-to-face clinics. That's partly because it's an efficient way, and a lot of people prefer teleconsultations for some visits or for interim visits. That saves them a lot of trouble. The issue is that different people, even within the extremely vulnerable group, have different levels of risk and vulnerability. So it's not the same answer for everybody. The government's advising that people who are extremely vulnerable on average in August can stop shielding and even go to work. But it depends on how severely you're affected and what your risk is. If you're on an immunosuppressant, like you have a kidney transplant, or if you have bad primary LAM, then you may need to be more careful than someone who's just got epilepsy. The answer depends really on the individual risk, and there's two parts to that, and it's something to bear in mind. So there's the risk of catching COVID, and that's the same for everybody in any one location. That's something you can see in websites and on the government website. The TSA has some links for this. And that will vary from time to time. At the moment, in most places, the risk is very low. Next part of risk is whether, if you catch COVID, how severely it will affect you. And that's your individual risk. And your overall risk is a combination of those two things. In terms of your individual risk, that's difficult to generalize about, and it's best to ask your TS physician about that. They are very busy, so they may not contact you spontaneously as things are changing, because in the nature of an epidemic, things change every week anyway. So apart from keeping up to date with what's happening on the TSA website and the government COVID website, you should also, if it looks like it's fine to stop shielding for you, contact your TS physician, drop them a line or email to ask what's the risk for you and can you stop shielding, can you go out? That applies not just to the individual with TS, of course, but it's the whole family. And they may be in contact with someone else who is shielding for other reasons. So you have to bear all that in mind when you work out what's best for you as a person and you as a family. One new thing, thank goodness, is that as shielding stops, we will now be able to visit our loved ones in nursing homes. It will still be wise to be cautious, and it depends on the individual nursing home as well and how much problems they've had and how COVID secure they can make the nursing home. And so the nursing home care staff will tell you, when you can go and how long for and how often. But when shielding stops, it will be quite safe. Well, it relatively quite safe. We're all at risk and we'll all continue to be at risk. It's really the level of risk is changing. What we hope for in the distant future is a good vaccine that will protect everyone, just as it does from measles or smallpox. And that is coming, but it's coming very slowly. And although there's 2 or 3 good candidates, it will maybe up to a year before we have that. Meanwhile, we'll see to the most we can to stay at lowest risk, although we can't live risk-free. And it's for every individual who's making a decision about shielding, whether visiting or going to work, it's a balance of the risk, overall risk, and also the benefit for them and their loved one. So sometimes it's very helpful for people's mental health to be able to visit them. Sometimes it makes no difference. Some people have to go to work in order to maintain a job and income, and some people will be more than glad to give up their employment and stay a bit safer. So everyone must think what's best for them and make their own decision. Everyone who can should wear a mask, but it's important to remember the mask is there to protect other people from you. It doesn't offer you much protection. To be properly protected from someone who's got COVID, you need a fully airtight FFP3 mask, the sort we use when we look after our patients in a hospital. The ordinary masks that we doctors and nurses included wear out in public are there really to stop us passing on COVID when we don't have symptoms and don't know we've got it. And that works by everyone who might be passing it on wearing a mask, so that it reduces the risk. Of course, that's not absolute, but it does make a big difference, we think. If someone's got COVID, then they shouldn't be out and passing on anyway. So it's only the people who don't know they've got it, and then it helps. But that leaves the problem of the people who, it's difficult. Some people have bad lung function, and that makes it very difficult for them to wear a mask. Other people have panic attacks, and then others, our children or our loved ones with very challenging behavior, just won't wear a mask. And clearly, then it's impractical for those people to wear masks, and the government's happy, and the health service happy with those people not wearing masks. You need to make clear, if you're doing that, why you're not wearing a mask. If anyone challenges you, not because it's that you're not a collaborative or cooperative person, but it's just a health risk for you and difficult. And of course, if you're not able to wear a mask, the more distance you can maintain from someone else, the better, and at least 2 meters, because that will keep the other person safe. So there are ways of working around it. One is to send other people shopping instead of yourself. as much as you can. Keep away from being in it. Most COVID spreads inside buildings and inside enclosed spaces and in crowds. The spread when you're out in the open air and distanced is much, much less. And we know that already from the earlier research work. So you can compensate for not wearing a mask if you need to. But as I say, the mask is there to protect others, not to protect yourself, really. Thank you for listening. I hope these answers will give you some clarity. Remember, the TSA is here to support you. Keep following us on social media, check the website, and get in contact with the support line if you need to chat to one of our TSA advisors, or talk to your doctors about your individual situation if you have medical questions. Thank you. Stay safe.